present my paper on incidence of eye diseases in rural and tribal population in Narsipatnam during district residency program. There is no financial disclosure in this study. Access to quality healthcare is a fundamental right, yet many rural communities face significant challenges in obtaining necessary medical services. Among the crucial healthcare services often overlooked in rural and tribal areas are the eye examination and the early detection of eye diseases. India rural population for 2021 was 96.8 crores and tribes constitute 8.6%, which is about 10.4 crores. Visakhapatnam district has a population of 42.6 lakhs. Rural communities often encounter unique challenges when it comes to eye examination and eye disease management. Some of the key obstacles include limited availability of eye care facilities, distance and transportation, socio-economic factors. My objective is to shed light to ascertain the importance of eye examination and the incidence of eye diseases in rural and tribal areas in Narsipatnam during district residency program, and to explore the screening methods and to create awareness for periodical eye examination, and to categorize the subjects based on various ocular diseases. This is a hospital-based analytical observational study conducted in 154 patients for a period of 3 months from March 2023 to May 2023 in Area Hospital, Narsipatnam. All the subjects underwent comprehensive ophthalmic examination where visual acuity, automated refraction, subjective verification were done. Intraocular pressure was recorded by applanation tonometry, anti-segment and detailed fundus examination were done with slit lamp and 78D lens. All the patients attending to ophthalmology OPD in Area Hospital Narsipatnam during DRP were included in the study. Patients less than 7 years of age and patients who would not give consent were excluded. These are the results showing the population in which 74.02% of rural population were there in this study, and the tribal population constitute about 25.97%. This is the age distribution chart showing more amount of patients in the age group of more than 45 years, which is 51.94, followed by the age group 21 to 45 years age. This is the sex distribution showing male predominance, which is 51.94%. This is the frequency of ocular diseases, in which the lenticular diseases was the major one, which accounted for 34.41%, followed by refractive errors, which is 26.62, followed by conjunctival diseases, retinal diseases, glaucoma, corneal diseases, and adnexal pathology. In our study, the most frequented ocular disease is the cataract, which is 34.41%. The following studies also have cataracts as the most frequent ocular disease. Pooja HV et al. Conducted a hospital-based cross-sectional study from July 2018 to June 2019 in ICAM patients aged 40 to 80 years amongst 2,912 subjects, in which males were more and the cataract was the most frequented ocular disease in that study. Praveen Vashist et al. Also conducted a population-based study in 2022 in persons aged 50 years and above and concluded that cataract was more common in his study. Few studies showed other ocular disease as more frequent in the population. Anupama Kumar et al. Conducted a community-based cross-sectional study in 2016 in 812 patients. 88.8% were elderly. Of this, males constitute 51.4% and females constitute 48.6%, and myopia followed by cataract was the study conclusion. V.K. Schrott et al. Conducted a community-based cross-sectional study in 2005 in 925 subjects and concluded myopia was more common, followed by conjunctival xerosis, hypermetropia, pterygium, and cataract. To conclude, as the specialist medical services are scanty in rural and tribal areas in India, there is a need to conduct more screening and awareness camps to combat the avoidable blindness. By emphasis on education, we can bridge the gap and improve the eye health outcomes for rural communities, enabling a brighter future for their residents. This can be done with trained paramedical assistant, and by tele-ophthalmic services, we can make significant progress in ensuring equitable eye care services for all. Campaigns for public awareness regarding surgical correction for cataract and correction for refractive errors should be strengthened. These are my references. Thank you.
Okay, thank